Dr. Sharkey, thank you for joining us. We're talking about allergy season, which is a big topic in this part of the world. So the first question is, when does allergy season officially begin in East Texas?
Allergy season in East Texas, if you're talking about pollen, usually starts up around the middle of February, toward the end of February. We'll get some of the tree pollen starting then, and then our grass season usually starts up around the middle of March. So for springtime allergies, February, March is when most people will begin.
Where can we find out what pollens are in the air, this time of year? Where can we get information on that?
Sure. UT Health Center does the pollen count for East Texas Monday through Friday, and you can find the results either on their own website. You can go to the local news stations and find their website, or the Tyler Morning Telegraph under their weather page reports our pollen counts.
What are the symptoms of springtime allergies?
I think what most people think of as springtime allergy is what we call hay fever, or that itchy, runny, sneezy. So itchy, watery eyes, itchy, runny nose, a lot of sniffles or sneezing, drainage running down your throat, maybe a lot of itching in your ears.
Is there anything I can do to prepare for allergy season ahead of time?
Sure. One of the biggest things is just knowing when your season is. If your doctor has prescribed medication for you that you need to be taking, then it's important to be on that medicine heading into your season. Studies say that if you start your medicine after you become symptomatic, you never do as well as you would if you're on the medicine going into the season. So make sure you're taking your medications. A lot of times there are things you can avoid. Pollen's usually highest in the morning. So if you know that pollen's going to bother you, staying indoors till midday is usually a good idea, keeping your windows shut. Just preventive precautions for pollens.
You mentioned medicines, and we're going to talk about them a little bit more in depth here in a minute, but what sort of medicines are typically prescribed for dealing with allergies?
We have a lot of different classes of medicines. Antihistamines, I believe, are the ones that most people are familiar with. We have over-the-counter antihistamines and prescription antihistamines. We have a class of medicine called leukotriene modifiers, which are helpful in some patients. We have 2 or 3 different forms, really 4 different forms of nasal sprays. Nasal steroids and nasal antihistamines are used commonly, and then some people will use a drying agent called Atrovent if you have a real drippy nose. And then you can actually obtain nasal chrome over the counter, and that will decrease allergy symptoms as well with regular use.
Well, you said over the counter. Can I manage my allergies using over the counter medications?
A lot of people can. It really depends on how severe you are. We have non-sedating antihistamines and sedating antihistamines. Now what I'd recommend is non-sedating antihistamines won't really impair you at work or school, so they're the favored ones. The sedating antihistamines have a better effect in terms of drying up drainage running down your throat, but they're more apt to make you sleepy, so you have to be a little more careful with them. You can get decongestants over the counter, but you have to be careful with those because in some people it'll raise your blood pressure, raise your heart, so there's more limitations to using those medications.
You mentioned nasal sprays. Are nasal sprays really addictive?
There's one class of nasal spray that's considered addictive, and that's the topical decongestants like Afrin, Sinex, Neosynephrine. So what happens is, if you overuse that medication, if you use it more than twice a day or longer than 3 to 4 days in a row, then what you're going to see is initially it will open you up so you can breathe, but after about 10 to 15 minutes, it'll close you up worse than you ever were to start. So it's like walking around with a clothespin on your nose. It's very uncomfortable. So it's not a chemical addiction in the fact that you just have to keep using more and more to keep your nose open, and after a while it's really difficult to get off it. In terms of the topical decongestants, if you're going to use them, we try to limit them to twice a day and for 3 to 4 days. If you're going to use them longer than that, then we ask to use a nasal steroid behind them, because if you do that, use your Afrin and then you wait about 10 minutes and use your nasal steroid, for up to a week to a couple weeks, it's been shown to prevent rebound swelling, so you don't get that secondary swelling.
Okay.
We don't do it indefinitely, though.
All right. And then, speaking of addiction, addictive properties, are antihistamines addictive? Do they have addictive properties?
They're generally not. Just no.
Okay. When do you need a prescription allergy medication as opposed to one you could obtain over the counter?
You know, I think when you've tried the over-the-counter medications and you're not getting better, there are some good non-sedating antihistamines over the counter, loratadine or Claritin, cetirizine or Zyrtec. And if you've tried that and you're still struggling with your allergies, it may be worthwhile to go in. The other thing is the antihistamines over the counter are good for itchy, runny, sneezy type symptoms, but they're not that great for being congested. So if you're having a lot of stuffiness, difficulty sleeping at night, then getting some of the prescription nose sprays usually work better for that. You know, I think the other thing you would look at are if you're getting a lot of infections. If you have a lot of ear infections or sinus infections, or you're just feeling bad and it's impairing your sleep and you're having difficulty at school or work, those are good indications to go in and see a specialist or your primary doctor for help.
Okay, and that segues in. Do I need allergy shots? When do I need allergy shots?
You know, we say allergy shots are for people that are doing their medication and they're not better, and they're doing the avoidance things, you know. So we've identified what they're allergic to, we've asked them to stay away from it as much as possible, and they're still struggling. You know, they're still having a lot of symptoms, they're still getting a lot of ear and sinus infections. Those people are good candidates for allergy shots. We also have people that just don't like taking medication. And studies have shown that people on effective immunotherapy or allergy shots can get off at least half their medications in the average patient. Some people get off everything, some people don't get off anything, but they're better, and most people will at least be able to taper off some of their medications. So not better with your normal stuff, or wanting to decrease medications or infections.
There's a new type of medication that I've heard about that's made some news, sublingual drops under the tongue.
Mm-hmm.
How do they work?
You have allergy cells at the base of your tongue, and you are using the same protein extract in allergy drops used in allergy shots. When you drop it under your tongue and hold it there for about a minute, it gives time for that protein to get onto the surface of these allergy cells or dendritic cells. And then they'll migrate to your lymph node and start these immune changes, which will give you the beneficial effect of immunotherapy. So basically, they'll take an allergic response and gradually try to make it a more normal response, and in some cases, a non-allergic response.
Are they as effective as shots?
In a lot of cases, yes, not in everybody.
Beyond medication, what can I do if I'm having problems to manage my allergies?
Well, you know, obviously, if you're really struggling, then going in and seeing an allergist, getting tested, finding out what you're allergic to, so then environmentally we can suggest things that might help you out. Then getting on an effective regimen. Not every medicine works for everyone. So, you know, some people will clearly do better on one class of medicines or combination of medicines than another one. And then if you have someone like that that's not doing well, then we do look at immunotherapy, whether it be allergy shots or allergy drops. So just someone who's not having the outcomes that you would hope they'd be having.
What are your thoughts on home comfort measures such as nasal washes?
They work great. At our national meetings, they stress that if you would do nasal saline washes several times daily at the onset of an infection, then almost no one would ever need antibiotics for ear infections or sinus infections. You get infected when mucus plugs up and it doesn't drain. And when mucus doesn't drain, it just makes a very nice environment for bacteria to start growing. So saline does two things. The salt content of it helps shrink back swelling, and then physically the water content is just washing plugs out of the way. So as long as you can drain, then you ought to be able to get better. So people that are congested a lot or having a lot of ear and sinus infections, it can be very helpful.
Very well. Doctor, thanks for your time today.
Surely, my pleasure.